So what we know about Zika, it's what they call a flavivirus, very similar to other viruses like dengue, West Nile, which is where it becomes tricky when we're trying to do those lab tests to figure out if someone has Zika or not. It can cross-react with other lab tests. It's new to us, we're considering it an emerging infection, something that's new in the United States, new around here, but it was actually identified decades ago in 1947 over in Africa and has very slowly made its way here. This is definitely the largest of outbreaks that have been identified since then, so it's, and as we'll learn, is being identified and linked to birth defects, which is also a new discovery, so this is why it's very important for us. The most likely mode of transmission is through the bite of a mosquito, infected mosquito, and that's, as Dr. Bressi mentioned, all of our cases so far have been people who've traveled outside of Florida to another country, gotten bitten by a mosquito there, come back, and then developed symptoms, became sick. So they've all been travel associated. There are other ways to get Zika. Again, with the concern for birth defects, we're realizing that if a pregnant woman gets infected with Zika, it can get passed to her baby through the womb. Throughout the United States, there have been 13 documented sexual transmissions, which is another unique thing to an arbovirus. Lab exposures, there's been 1. Transfusion cases, a few identified in Brazil. And it's also been detected in breast milk, saliva, and urine, but no cases of transmission have been identified through those means. What we're looking at Zika in general, very mild symptoms, incubation period anywhere from 2 days to a few weeks, meaning from when you're bitten or exposed. It takes some time for those symptoms to develop. Only 20% of people will even get symptoms, which is also a challenge to really get a true picture of how many people are infected. Thankfully, very few hospitalizations. That I'm aware, only 1 death identified so far in Puerto Rico, so not a lot of severe illness associated with it. Symptoms are very mild, fever, very low grade, rash, maybe some joint pain, conjunctivitis or red eyes. Those are the most common. Muscle aches, headaches, vomiting can be found, but their fever and rash are really what they tend to focus on. That presentation, it's a very general presentation, general symptoms, and they do think it's very similar to dengue or chikungunya, which is another arboviral mosquito disease that's made the news over the past few years. It's just a milder form. There is no vaccine. That would be the easiest thing in a tabletop exercise to say, oh, we'll just vaccinate everyone, but we're not there. And then also I alluded to those birth defect links, and also Guillain-Barré syndrome is another negative outcome that can come from people who unfortunately have some potential severe side effects. When we first started doing this presentation, the link was what the CDC and other organizations were researching to see if there was a true link between Zika virus and Zika infection and microcephaly, which is the birth defect highlighted here, where a baby is born with smaller brain development. Since this has been made, that link has been confirmed. They've identified it in brains and placenta, so it's definitely there, and now it becomes the work to make sure that we're getting the proper message out to pregnant women that they need to protect themselves from mosquito bites and what the effects could be on their unborn babies. The CDC, Dr. Bressi mentioned the over 200 cases of pregnant women in the United States who've been identified to have Zika. There's a pregnancy registry where they're following every pregnant woman through her pregnancy and through the first year of that child being born, and it may go longer. If a baby's born and it looks like the head is developed normally, they're realizing that there could still be some adverse effects that go on 3 months, 6 months, a year, whether it's hearing loss, trouble with vision. So there's a lot of unknowns on what we don't know related to Zika and pregnant women and their babies. So Dr. Bressi mentioned that emergency declaration, and along with that came an emergency rule, and this is what me working in epidemiology, what we kind of go by. The rule in the Florida statutes lists the diseases and conditions that are reportable to the health department. Zika wasn't on there, it wasn't really on our radar, it's there now. And the way it's written, we at the health department are to be notified of a suspected or confirmed case of Zika. So that's important for if someone goes into an urgent care, to a hospital, to a doctor. The doctor thinks this might be Zika based on symptoms and travel, call us right away. You don't have to wait for those lab results to come in. And as we go through the tabletop exercise, you'll see the importance of that. This is, again, just highlighting what Dr. Bressi already discussed, the number of cases so far here in Florida, and as well as the United States. And what we had just heard on a conference call earlier this week, and nothing formal's been put out, but kind of a sneak preview, they're revising, again, what they consider the case definition for Zika. Right now, for someone to be tested at our state lab, you need 2 symptoms. They're going to lower it to 1, and I do believe they're also going to be counting all of those people who are asymptomatic, having no symptoms, to really get that full feel for how many people here in Florida and the United States have Zika. So with that, we're going to turn it over to Adam. We're going to start diving into the exercise and go through and get started.
Good morning. So in everyone's packet on the right-hand side, you'll see actually the situation manual for today. All of the slides will coincide with, all of the pages in your situation manual will coincide with the slides that we have. Starting with the exercise schedule. And we are going to try and stay on task. If the conversations are going well, we're going to give you a little bit more time. If they kind of slack off towards the end, we'll wrap it up a little early, but we will be out of here before noon. That I promise you. So we're going to begin Module 1 here. It's going to be a briefing of a situation. You'll have discussion. On each table, you've got people that are going to be documenting for you and reporting out for you. This is a tabletop exercise. There are no wrong answers. If there are questions that you might have from your facilities, please write the question down. If you're thinking about it, we should be thinking about it and considering it for our planning as well. In some of the modules, not every single jurisdiction or entity out there might have actions, but keep in mind that there's something that you probably could be doing because something might come up further down the road. So keep that play of motion going as much as you can. While I'm presenting, Carrie will be walking around, kind of assisting the tables, making sure the direction of conversation is going the right way. When Carrie's presenting, I'll be doing the same thing to try and help you guys out. We've kind of strategically broken you all up into what we consider the major components to our response. So county and city representatives here, our healthcare partners here, healthcare partners there, our county partners here, and then the health department here will work together. So it's a little bit different. We're not mixing you all up, but there's kind of a strategic focus in these slides. So the objectives of today, after this training, you're going to be able to understand how to prevent or stop the transmission of Zika. There's really not a way to stop it unless we all kind of pull together and plan and effectively approach this. Rapidly detect the introduction of the virus, implement effective crisis and risk communications, and then protect vulnerable populations. So as we jump in, we know that the threat or hazard is the mosquito. Locally acquired transmission of the Zika virus in Florida by the Aedes albopictus Asian tiger mosquito as a vector. So there's your large-scale threat or hazard situation. Are there any questions up to this point that I can answer? This is going to be very 30,000 feet. So as we jump into Module 1, that's actually your situation. I want to just share with you what's going on. And you can follow along in your situation manual, but this morning, Jamie Jones went to his family physician with red eyes, a mild fever, and a body rash. The symptoms began 5 days ago. Jamie is a 36-year-old male. He's generally in good health. He has not traveled outside of the country since 2011 and has not had a blood transfusion. He informed his physician that he had relatives from Brazil visiting with him 3 weeks ago, though none of them had been sick during the visit. He's had no sexual contact with any recent travelers. Upon further questioning by his physician, Jamie said they spent a lot of time outdoors during their visit and remembers getting bit by mosquitoes. The physician suspects Jamie may have Zika fever and contacts the county health department. So your mission for the next 15 minutes, 20 minutes or so, is to have discussions based on the questions that are provided. These are just questions for your consideration, but put the situation into perspective of your agency, you are representing, this is happening, but don't limit yourself to just these questions. If your agency, like I said before, is not impacted by early detection of the Zika virus in the community, focus on what your agency would do to prepare for the threat of local Zika transmission across the county. We're going to give you 15 minutes. Look at the questions, go with the conversation, jot down your answers or questions. Yes, sir.
I got a quick question. When you test, what's the turnaround on the test results?
Turn around and test.
Turnaround on the test result. So that question has become more complicated. For a while, the state lab was the only lab that could do Zika testing. Now, commercial labs like Quest and LabCorp have a PCR test, so that is an option now for hospitals and urgent cares. And in general, I would say that takes, they say 2 to 3 or 4 days from once it's received at the lab. Same with the state lab. They prioritize those who are symptomatic versus, the people we're testing who may not have symptoms. So 2 to 4 days, we'll say in general. The first test to do is the PCR test, which is going to detect that active virus. And that can be done up to 2 weeks from when symptoms begin. And then after that, there's an antibody test that can go 12 weeks out that can detect it. So there's a broad range and opportunity to identify, and what it was published in as a CDC report, but it came from the wonderful work at our state labs. They found that in addition, most tests are done by blood tests, but if you collect a urine sample as well, they're detecting Zika in urine much longer than in blood. So, you can feel better, but still have that opportunity to identify it in someone. For people, the CDC's tried to put together guidance. A lot of the questions that we're seeing are, couples who are going away somewhere and they're not pregnant, but they want to be. So they want to get this screening test done, and that's not a reliable method. So they're saying if you're asymptomatic, wait at least 8 weeks before trying to have a baby. So they think it's at least 8 weeks that the virus could be in your system. I don't know if I can answer that thoroughly. Yeah, microcephaly is a birth defect that happens. It's, at a very low level. I think it's like 2 to 6 per 1,000 births, and it doesn't have to be tied to a virus, but it can be. So they started realizing in Brazil, once they realized they had a Zika problem, a year later, when they started looking at everything, they realized their microcephaly rate had increased. So I think it's kind of tied to, it may have always been there, but we've always had small outbreaks and small clusters. So now that it's become more widespread, in Central America, we're having that more transmission, more opportunity for birth defects. I think that might be it. All right.
All right. Questions are over. Like Mark just said, and that's a great point. These mosquitoes that will transmit the Zika virus are urban livers. Mark explained to me a while back there's differences in mosquitoes that migrate and fly far away. This is the guy that lives around your house. It doesn't travel very far. It comes out during the day. So this is why we're kind of facilitating this exercise, making sure that we understand, our communities understand, and know what we can do to help them prevent local transmission. Again, Manatee County has no imported transmission of the Zika virus today. We also have no local transmission in the state of Florida yet. So this is why we're trying to ramp up these plans with these exercises and get some information back from you so we can build a better, stronger plan once we do have that happen. So focusing back on the Module 1 questions, I know this does not affect everyone in this room, but have some conversations about what if you kind of start hearing through the rumor mill that this might be happening. Upon notification to the county health department, what actions might occur? Is a decision made to test the patient for Zika? Is the patient considered a person under investigation? What if this patient was actually came into your facility, what would you do then? Who is notified, and what information should be provided? What information should not be provided? What happens if the news media shows up at your front door, or the county emergency management office, or the county administration building? What additional information is collected as part of the case investigation? What medical guidance is provided to the patient? And what other actions can you take with your organization? Who would you be communicating with? What would you be communicating? What questions would you have? How can you protect your employees? Have those discussions. We're going to give you about 10, 15 minutes or so, but we'll pay attention to the conversations that are happening. And then we'll come back, report out, and move on to the next module. So about 9:15 or so, we'll stop and do a report out. Hope that gave everyone enough time to have the discussions, write down any questions, comments, concerns, review those questions that we had provided. So we're going to move into our report out period. We're going to start with our county representatives and work our way over to the healthcare. Actually, you know what? We're going to start with the health department and move our way through, because this module actually would kind of impact them the most, and healthcare. So we'll move this way around the room. So do you guys have someone that's going to report out?
So what we decided first would be is that we would conduct an investigation. Hopefully the hospital should report to us. We conduct an investigation to determine travel, if the people are still in town, things like that, his activities that he did. And then because of the symptoms and the history, we do lab testing. Either it would go, if it's with the hospital, usually they send it to Quest first, and then depending on what Quest results, if Quest ends up being positive, we usually do contact mosquito control. And while this is happening, usually Quest is sending it to the state lab for confirmation. And then, so while that's happening, we'll do protective measures, kind of mass spread of education of wearing long sleeves, doing bug spray, protective sex, emptying like water containers. And then if it is positive, we'd kind of go up the chain from the health department, Dr. Bressi, Tallahassee, the CDC, and then also contact local providers that we do have, and then ICS. And then local providers to be more aware that we could potentially have local transmission, and that we do have a Zika positive case. We would not provide any patient information. Mosquito control would know the address of the patient so they could do the mosquito control. And then the patient would continue with physician care, not to donate blood, do the protective measures, and yeah.
All right, we discussed that as soon as we had a suspected case, we would reach out to the Department of Health Manatee, notify them of the suspected case, and share the information about the patient, basically everything that was discussed in the scenario. Discuss the decision to test the patient, yes, and the person would be a person of interest, under investigation, excuse me. We notified the DOH of details about the recent visitors, give them a full breakdown, again, going back to the information that was in the scenario. We would also interview the other household members. Time's up, I guess. Oh, low battery. I'll speak loudly. So we're going to be interviewing the other household members to see if they're showing any kind of symptoms, see if they are possibly going to be infected as well. We're going to interview the patient about their career to see where they travel, if they work from home, if they work at a business, if they work in landscaping and travel around the county. Just try to get more information to see what other steps we need to take. Medical guidance, we're going to treat the symptoms, try to help them feel better as much as possible, but again, we're still learning about the virus. the Department of Health would also contact mosquito control of the suspected case, so they can go out and spray where they need to spray. And further information would be discussing with the patient about bite prevention, so to help prevent further transmission of the case.
Okay, so before or upon notification, we would continue to communicate among our individual agencies and the people within the agencies, continue to promote the awareness of Zika, and then identify methods of neighboring counties, what they're doing in the other counties to identify what we can do here in Manatee. And then it would not be the county's decision to test the patient, but we would definitely notify the county health department, and then we would refer to, if the person were in our agency, we would refer to our supervisor, which would then, if it were more than 3 days, go to FMLA leave, and then to the physician, which then would go to the county health department. One of the questions that were raised during this discussion was that the state statute may need to be disseminated and refreshed among county members so that everyone's on the same page in terms of referring or identifying and contacting with the county health department. And then again, questions 5 and 6 did not relate or pertain to the county, but number 7, other actions that are occurring, again, just continuing that awareness, and Bob mentioned having that person self-quarantine to an extent we could, whatever we could do at that point, I guess. Anything else, team?
All right. So the first thing is that mosquito control wants to be notified as soon as there's any suspected cases so that they can begin to eliminate vectors. And to do that, they need not just the home address of the suspected case, but their work address and any other places that they might regularly go to. We would like to notify other local health offices for surveillance along with EMS in case they are called to respond to flu-like symptoms along with the police department, just so they can protect themselves. Notify neighbors and distribute a flyer that has the local hotline numbers on it for more information, obviously in both languages that are here. The county health department should provide continuous updates on Zika along with the medical guidance and on repellents and alternatives if people are allergic or have a bad reaction to things like DEET. That's it.
Thank you, guys. So it brings us back to the end of Module 1. So basically what we know is we have someone in our community that's sick, and they had some travelers staying with them recently. So we're all a little heightened. We don't know exactly what's going on. We have our suspicions. I'm going to ask you to kind of move forward into the scenario and take the scenario for what it's worth, because this day will eventually come. Module 2 begins with the transmission period. So the county health department now has what we call a person under investigation, or a PUI, for locally acquired Zika. That means Zika is prevalent in our community. The mosquito has bitten an infected person and transmitted it to someone else. Laboratory results are pending and should be available by tomorrow morning. As part of the investigation, the following additional information has been collected about the patient. The patient, Jamie, lives with his wife, who is a 32-year-old woman, 3 children who are 7, 4, and 18 months old. Jamie has no pre-existing medical condition. He works as a lawn care technician. He notifies the county health department epidemiologist, Carrie, that he's worked in 3 neighborhoods in the last week. His hobbies include coaching his eldest child's soccer team 3 nights a week, which plays at the local recreation park, bowling, working on his collectible car that he keeps in his driveway, and playing with his kids. Jamie says he never uses insect repellent. He does get bitten by mosquitoes frequently, but the bites don't bother him. He lives in a large neighborhood, medium to low socioeconomic status. Sorry, lost my spot. There are approximately 78 properties within a quarter-mile radius of the residence of Jamie, the PUI. Some of the homes have no central air conditioning and rely on window units, open doors and windows, and fans to cool the home during the hot summer months. So with that additional information that we now have the person Jamie as a PUI, person under investigation. We're going to ask you to take a look at these questions, have a discussion, think about what you or your agency might be doing, who you might be communicating with. Same thing we did in Module 1. So what actions would be taken by mosquito control? What locations are mosquito control activities focusing on? What if that recreational park was in the city of Palmetto? Are there additional persons under investigation that are being identified? What actions are the health department taking at this time? Has public messaging started? Is there outreach that is happening in neighborhoods? If so, who's doing it and what personnel are being used? And what are the primary concerns of each of your agencies now that we know that we have this person under investigation? So we'll give you, again, about 15 minutes. We'll come back about 9:50, and then we'll move on to our report out and move into Module 3. Any questions? So we're going to start our report out for Module 2, and we will start again with the health department. Questions, comments, concerns, actions, what's going on?
So the first step we would take is that we'd spray at the address, work, places visited, and then we'd also request assistance from other counties, other agencies, WIC, Environmental Health, Extension Services, MRC, other volunteers. We'd implement the ICS. We would look into other possible contacts, so maybe like family members and like neighbors, maybe other potential PUIs. We'd provide education in multiple languages with concerns with the mosquito as well as the sexual contact, and also do have the health department contact info. And then we would consider doing a press conference so that we could kind of be ahead of it, as well as PSA. We'd also request public assistance in dumping their water, as well as doing protective measures like sleeves and condoms, bug spray. And then we'd also research best practices from other arboviral outbreaks, like with chikungunya and dengue. And then also talk to the EOC to see if they can provide any screens for the low-income neighborhoods. And then also to try to prevent spread as well as panic. So provide accurate information, maybe have meetings where the community could ask questions. That's about it.
Okay. So with mosquito control, the initial concern is stopping the spread and getting into the neighborhood and neighbors' backyards to identify if there are adult mosquitoes there and breeding. Initially, the target is the neighborhood in which the PUI lives, particularly because he works on his car there. And with the lawn mowing business, he's probably going into higher social economic statuses neighborhoods. If they are not allowed into the backyards. They have technology that they can use, such as larvicides or adulticides sprayed at night from a helicopter to really target these neighborhoods. The secondary target would be the park where the kids are playing soccer, and a sort of secondary way to get into backyards would possibly be use EMT or fire or the sheriff's office to maybe get a little bit more authority into these yards, particularly because there is the emergency declaration on this. Let's see, 3. Additionally, we'd want to look at his family members, see if there are any symptoms there, and let's see, door to door. By public messaging, we'd want to go door to door in the neighborhood and pass out flyers or talk to neighbors, see if they have any symptoms themselves, which EMT and police can do also. I think that was it. Did I miss anything?
The use of the drone.
Do you guys want to talk about that?
Well, we're getting a drone that basically for our hazmat team, but the drone is going to have high definition camera, thermal imaging, infrared. It's going to have it all. So we'll be able to quietly go in and do surveillance and offer protection to our personnel. So it's a good piece of equipment.
Very cool asset to actually have.
Yep.
Okay, so the first question we would defer to mosquito control. And for the second question, which locations would be identified? As Katie stated, the backyard, the 3 neighborhoods that that Jamie works in, the park, and possibly even the bowling alley. For additional PUIs identified, of course, the family members, we're also going to look at soccer players and residents in the neighborhoods. Well, not we as the county, but we would, again, defer to mosquito control. And then number 4 stated which actions would the county health department take at this time, and we looked at what the county will take at this time. So we identified that the utilities department identifies different items in the community that contain or retain water, such as tires. And there are also annual county cleanups that we may want to look into increasing the number of cleanups we actually have. There was also a discussion about the volunteer community cleanups where we would go door to door and ask for volunteers to assist in cleaning up the neighborhood. For number 5, has public messaging started? We would look for the county health department to activate the public messaging, but with our conversations that we had here, we learned that we have quite a few messaging systems, and we're able to disseminate a lot of the messages once Zika has been confirmed. Through the county, we have a bill messaging system through our utilities department where we can send a message to those separate neighborhoods if needed. And we also have inserts for different bills that you have through utilities that we can use as well. There is the code red messaging system that we would like to investigate to also disseminate the information, and we even spoke about the EOC Citizens Information Center that we could use. Neighborhood services within the county also has quite a few methods to outreach for community members that we would like to look into, but once again, from our discussions, we realized that we would only want to do this once the county health department has activated their public messaging. And then finally, the primary concern at this point would be accurate messaging, making sure that we're sending out the correct information, and then who in actuality has the Zika virus or our PUIs. Thank you.
That's great, thank you.
All right, mosquito control has said they're going to have boots on the ground. Locations that they're going to be focusing on are going to be the neighborhood around the PUI and as well as the soccer fields. Additional PUIs would be the other family members, the soccer coach, the players, lawn care workers, maybe even the bowling team themselves. The county health department is going to start monitoring cases around the PUI home, maybe members of the soccer team, the bowling team as well. Also starting the public messaging, again, going back to the soccer team, bowling alley, the neighborhood, handing out flyers, even though it's just a suspected case right now, maybe around the bowling alley they can put up some Zika flyers, start educating the coaches themselves on how to talk to the kids about Zika and making sure that they're doing mosquito bite prevention, wearing mosquito repellent. The DOH would also partner with the Medical Reserve Corps, starting to do door-to-door outreach in the area around the PUI. And then locally, with what we discussed here with the healthcare facilities, start educating the greeters and those in triage about what to look for as their patients are coming in case there's other suspected cases.
All right, now we're getting to the good stuff. We're moving on to Module 3. This is where it gets a little more beyond business as usual. I think, identifying a potential person and then, following those results to be positive. We do that a lot with a lot of other diseases, and it's good to hear the discussion and that, we're where we need to be. But jumping ahead to some of the challenges that could arise with these local cases. So mosquito control identifies Aedes aegypti and Aedes albopictus mosquitoes around the residents of the PUI. Later in the afternoon, the State Public Health Lab confirms that the PUI does have a positive PCR test for Zika. Case samples have been sent to the CDC for confirmatory testing. Confirmatory results will be available within 48 hours. So our questions moving forward, and this is a shorter module, so maybe we'll say 15 minutes, but we can tie in our bathroom break with that. How does the lab confirmation change the local activities? What messaging occurs at this point? How is the community notified? What resources are provided to the community? What resources are needed? Is the county equipped to handle the required activities? Start thinking about who are the vulnerable populations and how are pregnant women protected. So that would be 10:25. We'll come back and have our discussions.
I think it was a great collaboration between everyone in the healthcare department as well as other resources in the community that we can consult throughout this process should Zika come to Manatee County, and now we know the protocols and everything, so it was a really great information on what resources are out there and who we can connect with to address Zika in our community. One thing that's very important to know if you're pregnant currently and you have been traveling or have come in contact with someone who has traveled to a country that has a Zika confirmed case is to tell your provider, explain to them about your travel practices, and to see if you may be eligible for a test to see whether or not you are demonstrating symptoms, or to closely monitor your health should you exhibit some of the symptoms, which would be a fever, a rash, and some conjunctivitis or red eye or pink eye. Secondly, if you are breastfeeding, it's important to know that it's not transmissible, not yet known to be transmissible through your breast milk, so continue to do that, but monitor your infant for those symptoms as well. And if you are expecting or trying to conceive, to use protection if you have come in contact with someone who is been to an exposed country, or and just be aware of all of those things. So would you like to add anything, Cecilia?
No, just as the care coordinators, we'll do our best to educate our moms and moms-to-be as to how to be prepared for the Zika virus.
Oh, absolutely. I've been to other tabletop exercises, but this one over a Zika virus is excellent. because it was able to put us through the different stages of this event. From the beginning of the suspicion of the person being sick, and then the notification of the public, the health department, everybody's involvement, what part that they play into it, all the agencies, keeping the community educated of that particular virus, and then how we can prevent it locally throughout the neighborhood. So again, it's excellent tabletop exercise, a lot of good information that's going to be taken back.
So prevention is key then?
Prevention is huge. Because again, we out there, our homes, we forget about these flower pots that have the little basins underneath them that have water, or empty flower pots that we forget about, and they sit there, they get rainwater, and that's what harbors the mosquito, or old tires, or anything that can hold water.
So what's the takeaway? What do you want people in Manatee County to know about being prepared for?
Well, first off, just to make certain that, again, not to cause panic, because, again, education will cure that panic. The more that you can become educated, the more you're going to know about this particular virus and how to prevent it. And so if the residents, basically, again, they should know, again, to keep themselves abreast by going on to the Manatee County Health Department's website or the state of Florida's website to learn continuously updates about this particular virus.
The particular mosquito we're trying to control is not your swamp mosquito. It's not the mosquito that comes out at night and drives you indoors. This is a mosquito that is only found in people's backyards, in containers that hold water. And so mosquito control can't do the job of controlling this mosquito and preventing disease without a lot of community participation. We need all the different aspects of community participation to try and get this message out to the public, and also to be prepared should we have any cases of Zika. We have no cases as of currently, but if we do get an imported case, we need to know how we can react quickly and how we can rely on all our partners in the community to help us out.
And what preventive measures is mosquito control taking to ensure that we stay Zika-free throughout the summer?
Well, I mean, we are getting the message out to everyone that, again, this is not a mosquito that we can eliminate without the public's help. So a lot of the messaging we're putting out is this public education. This is what you can do to help. We can knock down the mosquito using our helicopters and trucks, but it's very temporary and they come back. So it's not the sort of thing where we want to be putting out trucks over the whole of Manatee County, every week to try and control this mosquito when we know it's going to come back. Now, should we have a case in Manatee County, we know we can react quickly in the area where that case occurs and knock down those particular mosquitoes which are at the highest risk of actually picking up and transmitting the disease.
Now, is there any chance of this type, the Aedes aegypti,
Aedes albopictus, yeah.
Of crossbreeding with other mosquitoes and becoming more of a problem, having more mosquitoes to Zika carrying?
No. I mean, these two mosquitoes are both exist here in Manatee County, mostly Aedes aegypti. Aedes albopictus is actually a recent arrival. It came into the United States in the mid-1980s and has made its way throughout a lot of the South, although in Manatee County it's less of a problem than Aedes aegypti. But no, these are mosquito species, so they cannot interbreed and produce viable offspring. Aedes aegypti has been around in the United States since it came from Africa in the 1600s. So it's got a good foothold. It's a tropical mosquito. You tend to find it more in the southern states, and it's always going to be a problem as long as people have containers in their backyards.
Okay, and so what can people do, like as far as insect repellent, anything like that? What are the types of things that are being recommended by mosquito control, or maybe by the health department, or
Right.
agencies such as that?
Again, I mean, the message we try and get out is, first of all, eliminate anything that's producing mosquitoes in your backyard. Obviously, you can't do anything about your neighbors' backyards, and if you still do have mosquitoes in your backyard and you like to be out in your backyard, particularly in shaded areas, then it is recommended that you wear repellents. And there's some very good resources to look at the best repellents. If you just Google the CDC and repellents, there's some very good resources there telling you which are the best ones, you know, what alternatives are there to the standard DEET that we have. There's a relatively new products which have a product called picaridin in them, and there's some other ones as well. Some people like to use what we might call the botanical repellents. They're made from nice smelling, you know, rosemary and eucalyptus and whatever. They're not quite as effective. I mean, they will work for a short while, but if you want to use those, make sure you reapply them pretty often. They'll only last for maybe a half an hour to an hour.
Excellent. Anything else you want people to know?
No, we need your help. I mean, in order to make sure that we keep Manatee County Zika free, that we don't have any local transmission, we need everyone's help to try and police their own yards and their neighborhood and try and keep them all clean.